These are the hands of Sally Sanders, who is not your typical retiree. Well, that's because she still works. Work is therapy for Sally.
So you made the decision a few years ago to retire.
Yes.
Was that a hard decision to make?
At the time, no. It wasn't for that time, because you know why? Because I knew I was coming back.
Okay.
Because I knew I wanted to come back. When I retired from 40 hours. Mm-hmm. And then I wanted to go back and do my time.
On your terms.
On my terms.
Yeah. Dr. Joseph Tingen has worked with Sally.
She just brought such a just calming feeling to the room, made everyone feel safe and comfortable.
Dr. Jonathan Loki is a surgeon who, when training, worked in the operating room with Sally.
Seeing you and hearing that smile in your voice was like, okay, you're here, it's going to be okay. And I remember that every day, just being so happy you were in the room. And if there was a day where you weren't there, it was like, oh, the light is out of the room.
Oh, well, thank you.
Happy.
She just really brings that vibe to the group and to the team. A positive attitude, never raising her voice or saying anything negative about anyone, and just always being a positive light within the team.
Light illuminates a room, and for many surgical residents and attendings, Sally has been that light, a guiding force. But where does that light come from? Sally hasn't always been in the OR. In fact, this is her second act. She made a pivot at 45 years of age that totally changed the trajectory of her life.
Well, I was doing textiles, working in sewing places. Like we made Sears clothes for Sears Junior Bazaar dresses and all of that. Well, every morning we came in the 80s when all the trends coming in and everything, the textile was leaving the country. So we would come in every morning and say, closing the plant next week, You can't buy a refrigerator when you're thinking the plant is going to close. So then I decided I would go into the medical field. Okay. And at my age, I was already about 42, so I didn't want a career that was going to take too long to finish. So then I decided to become a surgical tech because it only took 2 years to do that. And that's what I did. And I had to go back and get a GED. So I did that. And then I enrolled in the surgical tech program, and I finished it up at age 45.
She was also the second oldest person in her class, but she made it through school and her training, and soon she was making an impression on those in the OR, including Dr. Tingen.
Even as a young surgical trainee, I could just tell that she was one of the most experienced people in the room.
Yeah. Was there ever a time when you're operating and you perhaps didn't know what the next step was, and she handed you an instrument? And
absolutely, it's like I'm reliving it right now. You'd be doing a case, as a young trainee, not sure what the next step is, and you look at Sally, and she's giving you the right instrument or the right tool at the exact right time. She had done it so many times in her career that she just knew the flow of the case, how it was supposed to go, exactly what you needed at the right time, and she was always there for you, and that's who she was.
Sometimes the attendant, they have things going on in their lives and they get a little grumpy and all of that, and they come in and they want to be yelling and all at the doctor. So I would always just pat the little resident on the hand. It's okay, it's going to be all right. And then I'd squeeze the attendant's hand. Don't do that again, you're scaring him,
Sally has worked in the OR for 25 years, and in that time, she's witnessed surgeons making large incisions to making even tinier ones with the robot.
You still had a role to play.
Yes, we still had a role to play because we had to hand it to the doctor. We had the gun that would do the clamp cutting the tires. I had to pass it to him, so that's kept my hands going, kept me busy doing that. The robotics, even though they do surgery with the robot, we have to set it up. We have to get it ready for him to use, to operate.
Even with her career blossoming, she still had the greatest of her roles to play, that of mother. Sally had a daughter who was her namesake, but known as Nene, who helped her mom learn and navigate her way around her new college campus.
So then my 18-year-old, she boosted me up. She helped me with classes and she took me around the campus and helped me get enrolled in, and it was great.
Being a surgical technologist and a mother, Sally has also been a witness to life and death.
What do you remember about the day of her accident?
It was December 14th, 1997, and she had gone out with her friends, and about 2 o'clock in the morning, we got a phone call that said she was in an accident. And I went to the hospital, and her name is Sally also, and they thought it was me. Some of the nurses that were on duty thought it was me, so they came running to the emergency room, and they didn't recognize her.
Her daughter had suffered severe brain injury, leading to long-term complications and severe disabilities.
And they told me that she had a TBI, traumatic brain injury. Dr. Miller told me that she probably wouldn't speak again, that she probably was blind, and that she'd probably be in a vegetative state a long time.
Her work life and her family life had collided.
She had a devastating brain injury. And I remember thinking that we could easily, with all the technology and all the help, fix everything else, but that we couldn't fix her brain. And I remember thinking how that was going to be just a broken thing that we really could never make better.
Sally's daughter lived for 10 years after the accident.
And they helped me when my daughter was in the hospital. They helped me just be strong because I knew they were taking care of her. You know, I knew she was in good hands all the time. And that's what made me stronger with them. After she passed, they all came to my aid again. Everybody in the hospital, it seemed like they came. They made sure I had what I needed, you know. My supervisor told me, don't worry about anything. And when I got ready to pay for her funeral, it was all there.
Her work family, including the same doctors she helped to train, made sure all funeral expenses were paid in full. Sally continued to work after Nene's death, and when Sally retired the first time, the surgeons and OR team commissioned a plaque to commemorate her time spent there. It hangs outside the OR room now.
We decided amongst the pediatric group and the residents that we would honor her with a plaque and kind of make one of the ORs kind of Sally's OR because she had spent so much time there.
Help is best received when it's also given.
What would you extrapolate her legacy to be?
I think it depends on how well you know her. If you know about how she came to this job as not her first job, and she really picked herself up by the bootstraps, completely learned something new, and went into a new field, that to me is an inspiration.
And you think doctors are too busy to get involved in people's lives, but then her doctors all came to her wake, all of them came. The doctors that I worked with came to her funeral, and that was great, you know. It was just like they were my family. My residents came, gave me support, and I really do appreciate that.
Sally says what sticks with her the most is the help that she received without even asking for it. People retire all the time, but the way Sally made the pivots with life's challenges is a story itself. Life's lessons may not be easy, but how you apply them may set you apart from most. Those changes not only improved her skills as a surgical technologist, but also those of the countless residents and students she helped to train.
It's like you're not going through a crisis alone when you work at the hospital because of the involvement we are. We're entwined in each other's lives, and we just, you know, we're happy when a child is born, we're happy when they get married. You know, we share in the happiness and the sadness of everything when we work together. And that's what I love about it. And that's why I'm still there.